Hello, this is Dr. Scott Scher. It's a pleasure to be back with you. Hope you're having a great day. So today I'd like to focus on brain injury, concussions, traumatic brain injury. In fact, they're words for the same thing. Every brain injury is a concussion. Every concussion is a brain injury. All that really differs is the severity of the brain injury or the concussion. And this month, just the month we're just finishing here, is Brain Injury Awareness Month. And so even though it's at the end, I really thought it was important to discuss how terrible brain injury can be for so many. And in fact, it's the leading cause of what we call morbidity in patients less than 45 years of age across the world. And morbidity means disability, severe disability. Back pain is probably the most common disability, but traumatic brain injury is one of the largest causes of morbidity. So just to remind you all, I'm an internal medicine physician as well as a hyperbaric physician. I work with Hyperbaric Medical Solutions in New York as their head of innovation and protocol development. I also do worldwide consulting for hyperbaric therapy and advocacy and education in California and other places. I'm based in California through my website, integrativehbot.com. So I wanted to talk today about hyperbaric therapy again, of course, and how it works in brain injury. I think the most important thing to keep in mind is that hyperbaric therapy heals wounds no matter where they are. And a traumatic brain injury or a concussion is no exception. The brain is working at maximal capacity at all times. And it's very difficult for the brain to heal wounds that happen when there's injury. These injuries can happen from acceleration forces, deceleration forces, trauma directly to the head. They can be mild injuries or severe injuries. But no matter the injury, there's always a wound in the brain that occurs. And it's not just a wound. The way I think about it is, imagine a still lake. There's no wind. The water is extremely still. Then you throw a couple pebbles in the lake, and you get a direct impact of where that pebble hits the ground, or hits the water in this example. And you have the ripples that go outside of that. If you have a traumatic brain injury or a concussion, you typically have a couple of these ripples and a couple of these rocks hitting the water at the same time. And where the rocks hit, that's where tissue actually dies from the brain injury. If it's a stroke, it's a much larger area of impact. But it's the ripples that we call the pericontusional tissue, or the tissue around the area of direct impact that's stunned or just doesn't continue to function normally as a result of the injury. And this is where hyperbaric therapy can be so effective. Now you have to keep in mind that most brain injury treatments right now are not focusing on actually curing or even treating the wound itself, but actually managing symptoms. Antidepressants, antipsychotics, sleeping pills, narcotics for headaches are the most common prescriptions you'll see for patients with brain injury. None of these have ever been FDA approved for brain injury and are at the most patches, and at the worst even risking patients' lives from the suicidality and other risks that can happen with things like antidepressants. Hyperbaric therapy is not a patch. It is a wound healer, and it directly heals the wound from the inside out. We hyperoxygenate the body, we increase the amount of oxygen in circulation, and by doing that, we create and recreate the scaffolding of tissue that was injured from the brain injury. We revitalize the cells by revving up their powerhouses called the mitochondria. We decrease inflammation, we decrease swelling, and I've had a number of patients over the last several years that can finally think again, that can finally find their way without a map, can finally wake up without headaches. Or if they're from the wars in Iraq and Afghanistan, they wake up without nightmares, because there's a huge crossover between PTSD and traumatic brain injury, and there's several VA studies that have just recently come out that point to this. My favorite recent study is a study of traumatic brain injured veterans that went diving and showed how it was such a significant benefit to their healing. Now, when they were diving, they were under hyperbaric environments. They had an increased pressure from being underwater. They had an increased amount of oxygen in circulation. So they were getting hyperbaric treatment and getting better. Now, of course, it's nice to look at coral and fish, and that's, of course, helpful too. But the key there is the oxygen plus the pressure to drive healing. Hyperbaric therapy is a non-invasive, very safe therapy that can heal these wounds from the inside out. There's no doubt that it can be a vital aspect of brain injury recovery, and we see that every day. Patients that could not get out of a dark room, working and being a productive member of society. Patients on 25 different medications, coming off almost all of those medications, or just coming down on most of those medications. A dramatic benefit to them, and a dramatic benefit to their families and society at large. Thanks for listening. Please think about brain injury awareness. Think about your family members or know anybody you might know with a brain injury and have them contact me or us at Hyperbaric Medical Solutions. I know we can help. I see it every day.